Good morning. Thank you for joining us for the Maryland Food Bank's virtual town hall webinar. As supporters of the food bank, you've been invited to this webinar to learn more about how your contributions have helped our team navigate COVID-19 since March and our plans for responding to the ongoing impact of this pandemic. My name is Elise Krickow, the Food Bank's Senior Vice President of Development and moderator of today's webinar. Please know we are recording this webinar and only our presenters have the option to speak, so attendees will be muted. If you have a question you would like answered at the end of the presentation, please submit it through the Q&A function. You've heard a lot from us recently through impact reports, newsletters, and perhaps through the media, but we know you have many more questions. Our goal today is to share additional information and insight into how we're responding to the pandemic. I am pleased to introduce our Chief Executive Officer, Carmen Guercio, and our Executive Vice President of Programs and External Affairs, Meg Kimmel. Meg will be beginning today's presentation outlining the food bank's initial response to the pandemic.
Terrific. Thank you, Elise. Good morning, everybody. Thank you for joining us. We're grateful for the opportunity to share a little bit of information with you about both what those early days of COVID were like, as well as our thoughts for going forward. So we wanted to start by going back into the past a little bit and providing you with the opportunity to experience that with us, alongside us. It was an incredibly dynamic and an unforgettable time. So wanted to begin there. So of course, like everyone else, we watched COVID unfurl in real time. And we didn't know it was coming, no one did, but here's what we did know. We've seen this play out so many times before in the past, where any kind of disruption in services or supports, livelihoods, we know that families that rely on food assistance are hit hard and they're hit fast. So even before the pandemic, our own estimates showed that as many as 1.5 million Marylanders were food insecure. And so just to translate what that means, it means that 1.5 million Marylanders, and there are about 6 million Marylanders here in our state, lack access to the amount or the kind of food needed to remain in good health. So even though we didn't know what was coming, we did know very clearly that we had to get ready. And so the first thing we saw was that the entire food system changed almost literally overnight. The supply chain buckled. There were so many disruptions brought by the early days of COVID-19. And one of those was that traditional sources of food donations to the food bank dropped off significantly. Less food in the grocery store meant less food was being donated to food banks. So with foresight and very quick action, we began to purchase food. And it's a good thing we did, because by April, most of the food that we were distributing to our network of food pantries was food that we had purchased. And by May, roughly 90% of what we were distributing was food purchased by the food bank. And just for comparison's sake, a year before, we were buying 25% of the food. We were buying 25% of the food that we were distributing. So in those early days, food became both more expensive and harder to find. So there were severe limits on what we could buy. We couldn't buy what we wanted, we could buy what was available. And it's literally the same experience that many of you had in the grocery store, just on a larger scale. So what did the first phase of our response look like? So while we were busy buying food by the truckload in early March, we were also working hard to understand the need, or to begin to understand what the need would be. And of course, the expenses associated with meeting that need. So one of our early actions was to author a 90-day, $12 million COVID-19 response plan. And this plan was really helpful to us because it helped us to communicate the need to the funding community, to the state of Maryland, and to supporters like you. And so simultaneously, we reached out to our network of food pantries and feeding programs. Our immediate goal was to help this network of food pantries remain open and operational. Some food banks went to mass distribution events. I'm sure you saw many of those on the evening news at stadiums and shopping malls across the country. We chose a different path at the Maryland Food Bank. We chose to make sure that our network of food pantries knew that they could stay open. They just had to adjust to new methods to distribute food safely. And so oftentimes that meant holding drive-through events or doing curbside pickup, and we helped them to learn how to do just that and to do it safely. Another thing that we did very early on during COVID was we started to build something that we call backup boxes. This is an entirely new program meant to provide emergency food boxes so that people could stay home and still have access to food. So these are emergency food kits, shelf stable, designed to last for about a week. And ultimately they were distributed largely in Baltimore City and in Baltimore County, but they were distributed in other local jurisdictions across the state as well. And we've been really grateful. We'll talk a little bit about this more during this session, but we were really grateful for the partnerships that we were able to form, both with Baltimore City and Baltimore County, but also with other local jurisdictions in Maryland. Also at the same time, this is all, you're hearing a very long list of things that we did early on. We worked hard to keep our Pantry on the Go events running. These are really critical for us. They're pop-up mobile distribution events. They're a great way to provide assistance in hotspots. And we can also deliver both shelf-stable food as well as fresh produce. And last but not least, we converted our commercial kitchen operation. So we do summer, typically pre-COVID would be summer or after-school meals. Now it's just meals for children. And we converted the methodology that we use to provide that food into grab-and-go meals, which is really critical. So kids could still get the food they need, and it could be distributed safely. So the first 45 days of COVID were honestly a blur. Almost everything about how we work here at the Maryland Food Bank changed. And in those early days, we knew that we were looking at a level of need that we had never seen before. So we just kept reminding ourselves that this is what we were built to do. Pass it over to Carmen.
Thanks, Meg. Like Meg said, thank you all for joining us here this morning. Good morning to you. So I want to talk a little bit about how we fared financially. And frankly, the outpouring of support that we saw during this pandemic was nothing short of amazing. It really was beyond our expectations. And we, as an organization, are constantly looking at the silver linings that's coming out of this dark cloud called COVID-19. And this has certainly been a headline of that. The amount of support that we received from all over the state was tremendous. But also the number of new donors that we brought to the mission. There's thousands of people who historically probably knew a little bit about the food bank, but really had not been a supporter in the past, who are now more aware of our mission and more willing to provide some financial support. And the other silver lining, I would say, is this notion of awareness. I think Meg referenced some of the numbers of 1.5 Marylanders during normal environment who are having a hard time to make ends meet, are potentially food insecure, or looking for their next nutritious meal. And this COVID situation made that even worse. And so we've expected there was another 900,000 people in this state who were affected by COVID in some way, shape, or form. And now we're trying to figure out a way to provide for their families. So clearly a lot of activity, as Meg went through that. And if anybody if there was anybody out there who didn't know who the Maryland Food Bank was prior to this pandemic, they certainly know who we are now. But I would say that March, things were a lot murkier. We weren't quite sure how this was going to play out. There was a lot of moving parts. People were reacting as quickly as we could, and it was a bit of a perfect storm. Again, Meg touched on some of these, but demand spiked literally overnight as people were affected by this pandemic. Meg talked about the supply chain challenges. Costs were rising. Even if you could get food, the cost of that food was increasing pretty significantly. And then we had some challenges with some of the grocery store runs. So one of the first steps we took was to approach our board to potentially dip into our reserves so that we can begin to buy food as quickly as we possibly can. And as we were doing that, frankly, is when the state showed up in such a big way. And really, we didn't even need to dip into our reserves. Every sector of the philanthropic landscape stepped up. In the public sector, we worked, as Meg said, closely with the city and Baltimore County, but the state came through in a very significant way, and other jurisdictions across the state as well. And our relationship with many of those jurisdictions expanded in terms of the amount of interaction we had. We received support from corporations, large, medium, and small, some new to us, some not. Foundations were a big part of our success, as well as individuals, from scout troops who were doing food drives and lemonade stands to people who were turning over their stimulus checks to us. Collectively, this group of donors allowed us to really double our fundraising goals. And so it was really a tremendous story. And what it did is allowed us to respond, and as Meg said, respond quickly, as quickly as we could. The reality was there was a lot going on during that time, and as fast as we wanted to move, in some cases it was difficult to achieve that. Food was the biggest challenge there. We were ordering food by the truckload, but that food wasn't necessarily coming in by the truckload, and it certainly wasn't coming in on as timely a basis as we'd like. We were seeing 8, 10, 12-week delays in some of the orders that we were making, and when they came, because some of those orders canceled as they were going as quickly as we made them. And so really by the end of June, we still had about $7 million in open orders that we had made during the course of April, May, and June that we were still waiting on. And so what that meant was this significant influx of support that we received during the last quarter of the year. As quickly as we were trying to deploy it, much of that money is going to be deployed as we move into 21. And so when you look at our response to this COVID pandemic financially, looking forward, you really have to look at it over a 2-year period, because much of those dollars that we weren't able to deploy as quickly as we'd like in 20, we are deploying now in 21. I want to talk a little bit about the impact that we've had during this pandemic. And I think regardless of whatever measure you'd like to use, our impact has been significant. Here's a couple graphs here for you to look at, but on the one on the left, you can see on the red bar gives you a sense of the amount of food that we were distributing on a month-to-month basis relative to last year. And you can see the trend there was increasing each and every month. And the early August numbers shows that we're going to see a little increase in August as well. And so almost immediately we saw demand climb, and as food was coming in, it was going out. And if you look a little deeper, we try to look at 6-week trends and what we're seeing happening. And then over the last 6 weeks, we're averaging about 1.6 million pounds a week in distribution. If you do the math on that, that adds up to 83 million pounds for the year. Provide some context, in 2019, we're at 47 million pounds. A significant increase in the amount of activity and the amount of need that's out there. And so I want to talk a little about the approaches we took to try to meet that need. First and foremost, we did, and as Meg said, we encouraged our partners to stay open. We, many of our partners, we do our best work through a network of partners across the state, and we really worked hard with them to help them figure out how they can remain open, how they can continue to serve their local communities in a safe way, and continue to communicate with them as much as we possibly could around ways in which they can overcome some of the challenges they're facing in their communities. So we try to maintain as much normal distribution as we could. The other thing we started to do, as Meg mentioned, is buy food. We're buying food by the truckload to try to offset both the fact that our donations were kind of inconsistent and a bit insufficient. Frankly, it's a trend we continue to see today. We get notifications every week of a manufacturer who's shutting down production of certain types of food. So that inconsistency and insufficient levels continues into today. But you see on the graph on the right here, the amount of dollars that we spent to provide for those in need during this period. And if you add those bars up, it's somewhere short of $14 million of money, $14 million that we spent on food during this period. In a normal year, that would have been a little less than 3. So nearly or over a 400% increase in the actual dollars that we were spending to get food into our organization and into our communities as quickly as we could. I wish I could say all that was volume related. Frankly, some of those dollar costs were a function of increase in price. I think all of us who've gone to a supermarket have seen some price increase in some of the things that we buy every day. We're seeing that as well. We normally spend about 45 cents a pound on average for the food we buy. In August, that number was 75 cents. That's a 60% increase year over year, and it's something that we think we're going to continue to have to deal with in the foreseeable future. So normal distribution, buying as much food as we can. The other thing we started to do is find new and creative distribution methods. Meg talked about our conversion to these grab-and-go meals. That's one aspect of our work that we did, and our kitchen converting from creating a hot meal to now a grab-and-go meal for people in need. We've done over 370,000 of those here in the last few months, to traditional sites, as Meg was referencing, in terms of summer sites and after-school programs, but also senior centers and non-traditional sites like Baltimore County Library. So we're trying to be as flexible as we can to reach as many people as we can. And the other thing we did, and again, Meg mentioned this with regard to our backup boxes, we knew we need to provide a response and an opportunity for our partners to continue to serve the local communities in as safe, low-touch a manner as we possibly can. And so we developed these backup boxes as one solution to that problem. And initially, we anticipated that we were going to build about 30,000 of them over the course of several months, and we're going to use our volunteers to do it. But our demand was really more than we expected, and we quickly had to pivot, and we stood up a third site operation where we began to manufacture exclusively these backup boxes. And the other thing we did was to reach out to the hospitality, restaurant hospitality field who were hit particularly hard by this pandemic to begin to employ folks who were displaced. And so we provided an opportunity for 25 and as many as 30 people to continue to earn a living for themselves and their families during this time, which we're extremely proud of. So more food purchasing, alternative delivery methods. We also had to find a way to increase capacity. And so we added more people to our organization to handle this 83 million pound pace. And we added more space in the form of about 45,000 square feet in two new locations. And so when you add all that up, our operating costs have begun to rise significantly. Today, we're averaging about $3 million a month in operating costs when I factor in all the things I just talked to you about. That's compared to about 1.8 million that we were realizing pre-COVID. And again, if you do the math on that, that's a $36 million annual run rate, annual cost rate of our operating costs. We as an organization pre-COVID typically would generate about $21 million in revenue. And so you see the gap that we're trying to fill here with regard to the amount of cost that's incurred to respond to this tremendous need. One of the things that's helping us maintain our costs is our volunteer network. They are a critical part of our operating model during normal times, and it's certainly proven to be that case as well during this pandemic. We initially had some significant challenges with our volunteer network because many of them are affiliated with corporations who during March's work from home and shutdowns, many of those volunteer shifts weren't able to be filled. But again, we reached out to the community, and this is another example of how the community responded to our need. We had over 20,000 volunteer hours from March through July, with 75% of those people who were volunteered for us were new to our mission. And then if any of you had a chance to interact with some of these folks here, their stories were amazing. Many of them were directly affected by the pandemic, either furloughed or job lost. And we're trying to find some way to give back, and we're truly inspirational and we're critical to our success during this time. I just want to take 1 minute to take this opportunity to say thank you to this amazing team of Maryland food bankers. We have been operating an all hands on deck approach since March. We've continued to ask our associates to come in each and every day, each and every week to help us fulfill this mission. They come in, they do their own job, and in many cases have had to fill in other areas of the organization where we've had gaps. And there's no way that we could accomplish everything we'd accomplish without such a dedicated and passionate group of Maryland food bankers. And I just want to take this opportunity to publicly recognize them and thank them for their efforts. Meg, I'll turn it back to you.
There you go. I'm off mute now. Thank you. So we were going to talk now, transition a little bit to looking forward. And just one note that we are looking forward in a few different ways. We are thinking about 12 to 18 months out. We're also thinking about the next 90 days. So the future for us looks like all kinds of different slices and dices on what's to come. And we're doing it that way because one of the things that we really learned during the first days of COVID was that our food system is really fragile. Especially the charitable food system, the food assistance safety net, as we call it. We have seen once again just how close so many people are to the financial edge. It's one thing to talk about living paycheck to paycheck, but when your income disappears altogether, hypothetical quickly becomes a reality. And so just to do a little more math, if you take the 1.5 million Marylanders that we knew were food insecure before COVID, and you add in that potential additional 900,000 that Carmen mentioned, today as many as 1 in 3 Marylanders are likely facing the question, what do I do now? How do I feed myself and my family? So we know we have a lot of work ahead of us. We knew hunger in our state really well before COVID. And so as we begin planning for the fall and beyond, we sought out some experts to talk to us about what has changed in our state. We talked to economists, we talked to public health experts, and we also talked to disaster response experts. And we asked them first and foremost, what are you seeing? But then really interesting for us was the chance to ask them, what are you planning for? And so what we heard over and over again when we talked to these experts was this: the COVID-19 pandemic will disrupt the economy and suppress opportunity for months and years to come. So much like we did with our initial 90-day, $12 million plan, the Maryland Food Bank is creating now a phase 2 COVID response plan that focuses, as I said, on the near term and then also on the medium term. And to gain a better understanding of what food insecurity under COVID will look like over the next year or so, we took a deep dive to try to understand, in addition to food insecurity as we well know it, who else might be more at risk? And so in order to get there, we've done a couple of things. And I wanted to first note that the food bank was stressed and strained and challenged by the first phase of COVID. And we have not moved past the opportunity to learn about that and to make sure that our internal capacity and our processes are as strong as they can be. We want to make sure to build the capacity of this organization so that we can truly be more ready for phase 2 of COVID as we really lean into that work. So that includes, as I said, looking at our internal capacity, our processes, and strengthening those as we go forward to make the food bank even more resilient in the future. It also includes securing resources for the long haul, and that's both financial resources as well as expertise and talent. And also we're really energized by the opportunity to leverage partnerships. We've done that really well so far since March, and it'll be critical going forward to make sure that we're both extending our impact and not duplicating services, trying to meet this high level of need. So the other thing that we're doing that I call our evergreen work, because we always have done it and we always will do it, is the opportunity to continue to make our food distribution programming even more targeted and even more strategic. So we want to prioritize the areas of the highest need. We want to obviously continue to reach kids and seniors, which were really important populations that we worked hard to reach before COVID. But even this core work has changed dramatically and will present new challenges to us over the coming months and years. So in terms of looking at our future response, more specifically, according to the experts that we talked with, there are 3 groups of people who will face, or are facing, I should say, additional challenges under COVID. And the first area of focused attention for us at the food bank over the next months and years will be to get food and other supports to people who are suffering from the economic impact of the virus. So we know, and as do many of you, that the full financial impact of COVID-19 hasn't quite yet arrived. It will be with us, financial impact will be with us for a very long time. There's been a lot of fiscal stimulus activity since March. And so, for example, for many Marylanders, a $600 a week stipend that came in through federal CARES Act funding has helped to forestall problems with paying rent and other bills. Well, those payments expired July 31st. And so a new reality has emerged for many people. Temporary job loss will become permanent job loss. And we know that low-wage, hourly, and gig workers will be heavily impacted. All this is coinciding with the lifting of eviction moratoriums across the country, and the timing for that is not good. Fortunately, last week, or 2 weeks ago rather, the Centers for Disease Control and Prevention did issue a temporary halt in residential evictions until the end of the year. And so while that mandate will delay mass evictions, it won't really do anything to resolve the underlying financial crises facing so many families for the first time. So we know that lost income, unstable housing, uncertain financial futures will become the norm for more Marylanders. Again, many of them experiencing that reality for the first time in their lives. So the second area of focus for us with our phase 2 response will be to work more intentionally to eliminate barriers to food access that still face communities of color across Maryland today. So here at the Maryland Food Bank, we know well, unfortunately, that Black and Brown communities face disproportionately high levels of food insecurity. And the reasons will come as no surprise to anyone on this call. Many food insecure Marylanders live in food deserts. And these are communities that lack easy access to grocery stores or other sources of healthy food. In rural areas, a lack of reliable transportation can be the barrier to food access. And in general, low wages and a lack of affordable housing also contribute to food insecurity in Maryland. So before COVID, just to look at some statistics, according to the USDA, Black households experienced the highest racial rate of food insecurity, 21%, versus 8% for white households. That was before COVID. So now the situation is much worse. We looked at a research report from the Kaiser Family Foundation, and they report that since February, 45% of Black adults say that they have skipped meals or relied on charity or federal food assistance, compared with 18% of white adults. And so just as we've celebrated frontline workers, sanitation workers, restaurant and kitchen staff, drivers, it's also important to recognize that these are jobs that pay lower wages and cannot be performed from home. So these workers can either put themselves at elevated risk by remaining on the job or face losing their incomes if they can't work. So these are some of the driving forces that are pushing us to do more, to focus to more intentionally focus on the needs of communities of color. And so finally, we'll focus on people that are homebound. And we know, and we heard from the experts we spoke with clearly, that if we can help people who are sick or who have elevated risk factors remain at home and not go out to get food, this will help control the spread of COVID-19. So this too will be an area for us under our phase 2 response. A couple of last focal points for us. One, we've talked about the backup boxes, and you got to see some statistics about how that program came to life. Now, thanks to some easing of the supply chain and a little bit of time for planning and building, we're about to launch what we're calling Backup Box 2.0. And so it's the same idea. It will just have more nutritious food in there. We've been able to put together a really nice menu of options for those boxes, and also we'll put recipes in there and some nutrition education. So some flyers and inserts into the boxes. It's been a really effective program that will continue as long as the need exists. And we'll also continue to work with local jurisdictions, as I mentioned before, both to stretch resources and to co-plan about how best to meet the need. Counties and cities have access to data that we don't have here at the food bank, so that data sharing that we've been able to tap into has been incredibly helpful. And we know that by working together, we can continue to target high-need communities, including those communities of color, and target areas of elevated job loss. So maps, data sharing, and a chance to plan together with our counterparts in local government has been a silver lining in COVID, and one that we really want to continue to work.
All right, thanks, Meg. And thanks for sharing some of the tenets of our phase 2 plan. I'm really excited about where we're going to go here, but I think we want to spend some time talking about the financial impact of these plans. We have spent a lot of time developing financial scenarios and financial modeling around what it would take to continue to meet the demand that we're seeing today. I talked to you about 83 million pound annual distribution run rate. I've talked to you about our operating expense run rate. And Meg mentioned about the fact that we've also incorporated a number of feedback mechanisms from partners and experts in the field. And we know that there's things happening at the government level with regard to supports and the likelihood of many of those going away if not already. And so when you factor all those in, we fully expect that we will have to be in a position to be operating at the levels that I just referred to here with regard to poundage and expenses, and potentially more. And so we have to find a way to fill that gap. The good news is the success that we've seen financially over the last quarter of our fiscal 20 is helping provide some tailwind here getting to 21. It's allowing us to continue to operate at this level during these early days. But the challenge is the dollars we raise is not going to be enough for us to achieve this 83 million pound rate or the 36 million in operating expenses that we expect to have even with the supports that exist in place today. So this next stage of funding is going to be critical to make sure that we're able to respond to that need. So as we've crunched all the numbers and created all these scenarios, what will it take to serve people across the 22 jurisdictions we serve in the state? And that number we've calculated to be $40 million. If there's anything that we've learned for the first phase of this pandemic, that number may seem daunting, but it's doable. When we built the phase 1 plan of $12 million over 90 days, we weren't sure that was going to be achievable, but it was. Thanks to the tremendous support from folks on this phone and others who have helped us achieve that milestone. And so the reality is, if we're going to do what we need to do to maintain the high volume that's necessary to support the demand that's out there, we're going to need to find a way to raise additional dollars and create public and private partnerships similar to what we have done already to help us do that. We're committed to be there for the folks in need, and we're committed to continue the programming that we've proven to be very successful and effective during this first phase. And we're also committed to improving every day as an organization to get better and better at the work we do. And so we're excited about this next phase of work. When you look back to March, when COVID hit as suddenly and dramatically as it did, the Maryland Food Bank was put directly in the spotlight. A number of eyes turned to the Maryland Food Bank for help. We have more and more people in need than we ever have, many of which for the first time who didn't know where to go to get food. We had pantries who were trying to figure out a way to stay open and how to continue to manage through this process safely and effectively. And we had other organizations approaching us to say, hey, I want to help. We had donors were looking for opportunities to provide support and assistance to our cause. We had farmers and governments who were also looking for direction and action and leadership. And frankly, we were the best organization. We were best positioned as an organization to do this work. We have a tremendous network of partners all across our state. Some of you on the phone today who are positioned to serve their communities. We have a number of donors who've stepped up in a big way. And so we're very well positioned to respond to this need. And frankly, I couldn't be more proud of the impact that we've had so far. As Meg mentioned, food banks talk about being built for crisis and crisis response. But clearly, this is beyond anything any of us would have imagined. And what I'm proud to say is the safety net, the food assistance safety net that we've developed over the last 40 years stood up nicely to this first round. But we know that's going to take a lot more over the next 12 months and beyond for us to continue to do this work. And frankly, we're bracing ourselves for this journey. If we learned anything from the last recession of 2008 to 10, we felt the effects of that in our business right through 2013. Even as the economy improved for many, it was too slow for far too many others. And so I want you all to know that we are up for the challenge, and that with your support and help, we know that we can continue to make an impact. Thank you very much for all you've done for the Maryland Food Bank and the confidence you bestowed in our organization, and we look forward to continue to work together. I'll turn it back to Elise.
Thank you, Carmen and Meg, for sharing a little bit about our journey thus far and for providing some insight into our plans as we look ahead to the next year. As Carmen said, it's daunting, but it's doable, and we're grateful for the support we've already received from those of you on the phone and from others in the community. We've had some questions come through the Q&A, as well as some that have also come in advance of this call today. So I'm going to start with one from Virginia. And she asked if we could talk more about our network of partners. Could you give some examples? Thank you.
Yeah, so I'm happy to. So we have partners of all shapes and sizes and types all in every jurisdiction of the state, across the state. We deal directly with schools, several hundred schools across the state who are serving their local communities. We have a number of organizations that are faith-based organizations. We have weekend backpack programs. We have organizations who solely distribute food. We have organizations who do much more than that and trying to solve other kind of root causes of hunger and more holistic responses to the need. We have organizations who are largely volunteer only and others who have paid staff. So it's a mishmash of organizations out there in different shapes and sizes who are really critical to our work. We call them the last mile. These are the folks who are on the ground every day taking the food that we're working so hard to try to source and get to them, and making sure they're getting into people in need in their local communities, because they understand those communities much better than we ever could sitting from where we sit. And so they're critical to our mission, and we couldn't do our work without them.
And I might just add, I mean, I think thank you for asking the question. It's a great one. We think about our partners in categories, and then there's a lot of ways to look at them. But if you look at our largest set, we have over 1,200 distribution sites, places where our programs are deployed across the state of Maryland. But within that is a subset of what we call network partners. And those are the food pantries, the ones that Carmen is describing. And that's about 350 organizations that are working directly with us. We have MOUs with them, and they have access to our menu to order food. And so that's kind of that's kind of our core group. And then some of the other things we have are, we have our school pantry network, and we run the state's emergency food assistance program called TFAP. So we have a network of TFAP organizations as well. So lots of different ways to slice and dice that group of partners that we work with. And they're all essential under COVID. Even our school pantry program, we're trying to get that back up and running for the fall. It went pretty dormant in March. And so we're working hard to see what we can do to partner with school sites to distribute food there safely starting in October. So it's a great question. And I'm trying to think if there's a good resource. Let me give that some more thought and think about a good resource. If there's a newsletter article or something that we could share out as a follow-up, just as additional information.
Great, thanks Meg, thanks Carmen. We have another question from Scott asking us to describe the expected breakdown of the 40 million that we need to raise for operating expenses. How much is likely to come via government, foundations, and charities and individual donors?
Yeah, as much number crunching as we've done, Scott, frankly, we haven't really broken it down by segment, particularly in terms of which those segments we expect to pick up which aspect of it. We were very fortunate in our $12 million response that we had $6 million in support from the state, and the balance of that was picked up by philanthropic activity across the other donor segments. So, we are currently in discussions with the state about seeing what level of support they might provide. And so that's going to be probably the biggest driver ultimately of how successful we are. But we really are trying to work every angles, each of these segments as we possibly work with each of these segments as much as we possibly can, and really aren't necessarily looking at any one particular one for a certain target, if you will, than the other. It's a pretty broad-based approach to making sure that we get to this magic number.
Mm-hmm. Yeah, and I think that we have. I think that was exactly the way we're thinking about it. The way Carmen described it is we're starting off by seeing what support we can get from public sources. We know these big numbers. When we have a big fundraising number like 40 million, that's not going to come through private donations alone. So we know we have to start off by looking for public sources of support. We were very successful with that approach last time, and we do have an ask into the state to see what part of this they will pick up. The number that, there's another number floating out there that I just wanted to touch on, which is $28 million. That is the number that we've put forth to the state as our above and beyond our normal business as usual expenses to address the needs of COVID. And so we've also released that last week in a press release. So if you do see that $28 million number floating out there, that's our above and beyond number, and then the delta there is what we would consider business as usual, what it's going to cost us to run the food bank, COVID or no COVID. So once we hear back from the state, and we know that they're waiting to see if there's a second stimulus package coming, because a lot of the state funding really came from the federal government. It dropped down to the state, but it was CARES. It was their federal dollars. So lots of interest in seeing what that might look like. We have a really strong partnership there. There's a very strong case for support, and we'll just begin, Elise and I will just begin the work of communicating this need out to the funding community, starting here in September and beginning of October.
Yes. Thanks for the additional information, Meg. We do have some work ahead of us, but we're up for the challenge. Wanted to ask a question about supply chain. How is that looking right now? You talked a little bit about what was happening back in June, but what does that look like for us right now?
Yeah, I'd say we've seen some improvement in turnaround times of product order to delivery. So that has improved some from where it was several months ago. And so that's a plus. I talked a little about the price increase. So there's still some price premium out there with regard to the product that we're purchasing. That's something we think we're going to continue to happen. And again, we do continue to get these occasional notifications from organizations who are, for a variety of reasons, whether it could be an outbreak at their facility or some other challenge that they're facing, are discontinuing certain products. So things that we hoped that we would be continue to buy or suddenly become unavailable. So there's still some noise, if you will, in that supply chain, and still some stress there. But the food, we started increasing the amount of our orders as this went along, because we knew the supply chain was lagging as much as it was. So when food did come in, we got them in bigger chunks. And so we're seeing the benefit of that now, but I would say there's still some challenges in it, but it's much better.
Thanks, Carmen. Meg, you mentioned partnerships earlier, and just wanted to talk a little bit more about who we're partnering with in the community to provide access to food and other services.
Yep, sure thing. So our primary focus has been and remains that core group of our what we call network partners. That food assistance safety net, that network of food pantries across the state was the food assistance safety net before COVID, and we want very much to make sure that it remains strong and survives COVID, because it is critical for every local jurisdiction that that there is a food pantry network that can be a resource for people in need. We are also working really, as I mentioned, we're working really closely with local county governments, and one of the real upside possibilities here in the future is to make more of a connection between county government and this food pantry network that we partner with. A lot of counties, as COVID hit, started looking around and asking, what's going on, who's doing what, how do we help, where do we start? And so if we can use this as an opportunity to form more connection and build more relationship between the food pantry network in each county and local government, and that's something that we can facilitate, then everybody's stronger and everybody's working together. So I would say those have been two really critical groups for us. And I would say the third, if I was going to mention just three, the third one would be temporary partners. So as we have about 77% statewide, that's our statewide average, 77% of our food pantry partners are still open and operational, which is a great result. And, but we know the need is twice what it was 6 months ago. So we've also opened up temporary partnerships with it's gotta be close to 150 new organizations at this point in time who are hosting pantry on the goes, facilitating food distributions, and really just trying to deploy resources into communities that are hardest hit. So that's been a big shift, and I think is one that we will, we have a team of staff here whose job it is to manage our programs regionally. And so those regional program directors are really looking at these temporary partners to see who's raised their hand and who's come on, and are they providing services in an area where we weren't previously. And so how many of these can we convert over to join into that network, that partner network, and become permanent partners of the food bank.
Thanks, Meg. I just also want to address Maggie's question about receiving access to a recording of this webinar. We can for sure send that out if you want to have a copy of it from our YouTube. We will be sending that out afterwards. So thanks for asking that, Maggie. I don't have any further questions for the group, but just wanted to reiterate our thank you to our funders, both public and private. You really stepped up to help us step up, and we are truly grateful for your support. The year ahead is definitely looking challenging, but as we said, we're up to the task, and with the help of our community members, we can do it. So thank you very much for attending our webinar. If you have any questions, feel free to contact me directly. ecrickout@mdfoodbank.org. It was up on the screen earlier, but thank you so much, and have a wonderful weekend.